Hi, my name is Marina Mendes. I am a DNP student and I'm excited to present my business plan for MotherLink, a virtual postpartum support network. I'm here today to address a critical yet often overlooked issue in our healthcare system, the postpartum care gap. Right now, the United States is facing a significant maternal health crisis. A staggering 60% of new mothers, which is more than a half, do not attend their crucial postpartum follow-up visit. And this isn't just a missed appointment. This absence leads to serious preventable complications, both physical and mental, and it worsens the health disparities that already exist in our communities. This is a gap that we can no longer afford to ignore, and that's precisely why I created MotherLink, to provide a direct, effective solution to close this gap and ensure every mother gets the care she deserves. So, how do we solve this problem? Our solution is MotherLink. Our mission is simple and direct: to deliver equitable, accessible, and compassionate postpartum support through innovative telehealth solutions. We leverage technology to break down the barriers that keep mothers from getting the care they need. This mission drives our ultimate vision: a future where every new mother, regardless of her location, her income, or her circumstances, has reliable and consistent access to high-quality postpartum care. And to achieve this, MotherLink is a nurse practitioner-led virtual maternal health service. We are not just a technology platform, we are a dedicated clinical service bringing expert care directly into the homes of the families we serve. So, what do we offer that makes MotherLink truly different? We provide a comprehensive suite of integrated postpartum services, all delivered by one cohesive clinical team. This team includes our licensed nurse practitioners who manage primary medical needs, our board certification lactation consultants for expert feeding support, and our licensed clinical social workers who focus on vital mental health and emotional well-being. The key here is that this is not just a collection of separate services. A new mother isn't forced to juggle three different apps or providers who don't communicate with each other. Instead, she has a single trusted team that understands her entire postpartum journey. This holistic and integrated model is our core advantage. It allows us to provide seamless, relationship-based experience and a truly superior level of coordinated care. To make the greatest impact, we are taking a very focused and strategic approach to our launch. Our service is designed for new mothers in their first year postpartum, specifically those between the ages of 18 and 40. We are launching our program right here in our community, focusing on residents of Butler County, Ohio. Crucially, our primary focus is on serving our most vulnerable population. This includes Medicaid eligible families and mothers living in rural areas where access to specialty services is scarce. These are the women who face the most significant barriers to receiving traditional in-person care, from the costs associated with an appointment to the challenge of finding transportation and childcare. MotherLink is built specifically to serve them. An ambitious vision like this requires an exceptional team to bring it to life, and that's exactly what we have. The clinical vision and strategic direction of Motherlink are driven by our program director, myself, with my doctorate in nursing practice focused on health systems leadership and more than a decade of frontline nursing experience. I will bring the perfect blend of high-level strategy and deep, patient-centered understanding of postpartum care. Completing that is our operation and finance lead, David Chen. David is the essential operational and financial backbone of this project. With 15 years in healthcare administration, he has a proven track record in launching successful telehealth services and navigating the complexities of payer reimbursement. Together, myself and David lead our dedicated clinical care team, an interdisciplinary group of nurse practitioners, mental health professionals, and lactation consultants who deliver our services. And finally, this entire initiative has the full support and sponsorship of our CNO, providing the executive leadership and institutional commitment necessary for our success. So how will we connect with the mothers who need us most? Our approach isn't based on broad, expensive advertising. Instead, our strategy is built on trust and direct integration within the healthcare community. We will build a robust and reliable referral network by making Motherlink a seamless extension of the care already being provided by our key community partners. This means working directly with hospital discharge planners, OBGYN offices, local pediatricians practice, and WIC clinics. By integrating directly into their existing workflows, we become a trusted and natural next step in a new mother's care journey, ensuring we reach the right patients at the right time. Now let's turn to our financial plan for the first year. Our initial 12 months will operate as a pilot program, and this is by design. The primary objective of this pilot is not immediate profitability, but rather to collect the robust clinical and operational data we need to secure long-term reimbursement contracts with Medicaid and private payers. Looking at our projections for the first year, based on serving an initial cohort of 250 mothers, we anticipate approximately $125,000 in revenue. Our operation expenses are projected at $756,400, which leads to a first year operation deficit of $631,400. It's important to emphasize that this deficit is expected and is a core part of our launch strategy. It represents the critical investment required to fund our expert personnel and technology infrastructure while we establish the service and demonstrate its value. This initial investment is the essential bridge to achieving long-term financial sustainability. This brings us to the investment required to make this vision a reality. To launch Motherlink and fund our critical first year of operations, we are seeking $756,400 in grant funding. This isn't just an expense. It's a strategic investment with a powerful, multi-layered return. For patients, it provides life-changing access to vital medical, lactation, and mental health services they would otherwise go without it. For healthcare systems and future payers, it represents a significant reduction in downstream costs by preventing expensive emergency room visits and hospital readmissions. And for our community, this investment directly tackles systemic health inequities and establish a new higher standard of postpartum care. This funding is the critical catalyst. It will allow us to launch this innovative service, improve the health of hundreds of mothers, and build a sustainable model that will redefine postpartum care for years to come. The success of Motherlink isn't just measured on a balance sheet, it's measured by the tangible positive impact we have on our entire community. We have a clear plan to track our performance across our key stakeholder groups. For our new mothers who are the very center of our mission, we will measure success through patient satisfaction surveys, their engagement and attendance rates, and direct feedback on their experience. For our financial stakeholders and future payers like Medicaid and private insurers, the key metric is value. We will measure our impact by analyzing claims data to demonstrate a clear reduction in the total cost of care, driven by lower rates of costly emergency room visits and hospital readmissions. For our vital community partners, the hospitals and the clinics who refer patients to us, success will be measured by the number of successful referrals and their feedback on how easy and effective our collaboration is. And finally, for our own dedicated clinical staff, we will track success through their job satisfaction and retention rates, ensuring we are building a supportive and effective environment for our team to deliver the best possible care. And by measuring our impact across all these areas, we ensure that Motherlink is creating sustainable holistic value for everyone involved. So in conclusion, Motherlink represents a timely and necessary response to the national crisis in postpartum care. Throughout this presentation, we have detailed a clear market need, a unique and competitive service model, and a sound operational and financial strategy. With a strong leadership team and a clear path to long-term sustainability, Motherlink is perfectly positioned to deliver significant social and clinical returns. The requested grant funding is the critical investment required to make this all possible. It will allow us to launch this innovative service, improve the health of hundreds of mothers in our community, and ultimately establish a new higher standard of care for the future. Thank you very much for watching my presentation. I'll be happy to answer any questions you may have. And this is our reference. Thank you.